We've all heard the adage, you are what you eat. And while we can all agree that proper nutrition is a key influencer of health, we know this doesn't give us the full story. In fact, the idea that all we have to do is make any number of personal choices like eating better food, exercising 30 minutes a day, or getting enough rest reinforces a very limited view of how individuals are able to achieve health. The reality, of course, is quite different. Each of our lives includes a unique history, a culmination of many different internal and external factors that determine whether we are actually able to live a healthy, fulfilled life. These factors are now more commonly known as the social determinants of health, which are the conditions in the environments in which people are born, live, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Examples of social determinants of health include availability of resources to meet daily needs, like safe housing and local food markets, access to educational, economic, and job opportunities, transportation options, public safety, socioeconomic conditions such as concentrated poverty and the stressful conditions that can come with that, and so much more, including access to healthcare services, which we'll be talking about today. So the social determinants of health we now know far outweigh what many people mistakenly believe to be the main drivers of health. In fact, an individual's zip code is now understood to be significantly more determinant of health outcomes than one's genetic code. It's important to note that the social determinants of health are systemic issues. They are not simply drivers of poor health based on individual decision-making alone. So today we'll talk about how these social determinants of health are tied to one of the biggest problems in society. That is, that healthcare disparities exist. They affect our most vulnerable. They are not caused simply by poor personal choices. And these disparities have created a health gap between the haves and the have-nots. So I'm here to offer a solution to this problem, one that envisions a transformed healthcare system that addresses and responds to the social determinants of health by more effectively utilizing social workers to close the health gap. So you might be asking yourself, what role exactly do social workers play in healthcare? And in order to start to answer that, I want to tell you a personal story as someone who has worked in the medical social work field for close to 15 years now. Early on in my career, I was enthusiastic and idealistic, and maybe a little naive about my ability to change the world one patient at a time. I had just landed my dream role as a hospital social worker, and I was digging right into the work, sitting with patients and their families when they had just received devastating news related to disability and illness, helping them plan for end-of-life issues, securing safe discharges to rehab facilities when home was no longer safe, and yes, even dealing with issues of child abuse and neglect, which is so often the picture that pops into people's minds, perhaps even yours, when they hear that I'm a social worker. But in doing the work, I felt alive and part of a team of healthcare professionals all focused on the same goal of improving the health and wellness of our shared patients. And it's not that that was false, but at the time, my own perspective and understanding about my role in achieving that goal was put to the test. So I was working a weekend shift, and I'd spend most of the day doing what I like to call putting out fires, responding to the most urgent needs and moving on to the next urgent thing on the list. I was finally getting a moment to eat my lunch when I saw a stat social work consult come through the system. So of course, I rushed up to the floor and met with the nurse on duty, who appeared so relieved to see me. When asked how I could help, she replied, "Mrs. Johnson in room 232 can't find her keys." So, a little confused about the request and its urgency, I asked again, okay, but how can I help? To which the nurse responded, "Well, we need you to find her keys. I don't have time to do it, so I called you, the social worker." It was simple as that. In that moment, all of my education, training, and eagerness to put my skills into practice had come down to searching for keys. So don't get me wrong, it wasn't that I didn't want to help Mrs. Johnson find her keys, but the reality of that situation hit me hard, because it was in that moment, and many others like it to come in my career, that it became very clear that many people, including the healthcare professionals that I worked with day in and day out, had very little to no clue what medical social workers do and how we are capable of contributing on a much larger scale. I also want to be clear that it wasn't that one individual nurse's fault that she wasn't sure what my role was. Social workers' roles are flexible, wide-ranging, and ever-changing to meet the needs of the moment, which has contributed to this confusion. And frankly, social workers as a profession, known for advocating for the needs of others, haven't been our own best advocates in this space. So this lack of clarity about the role of social workers in healthcare persists even today, and it matters. Because without a more accurate understanding and appreciation for the skills social workers bring to the table, we will continue to be underutilized, shortchanging the individuals that desperately need our help, while simultaneously leaving healthcare systems struggling to meet the growing demands placed on them to address the social determinants of health in order to influence better clinical outcomes while lowering the costs of care. So I believe the time is now to bring some clarity to the role of social workers in healthcare. And after today, I hope that you will leave with an understanding of why social workers may just be the key to closing the health gap. So let me pose what we in social work like to call the miracle question, which is, if you woke up tomorrow and your biggest problem was gone, how would you know? What would you see differently? And for our purposes today, what does a transformed healthcare system that closes the health gap look like? And what role do social workers have in this transformation? Now, hold on to this question and we'll circle back to it in a few minutes. But at this point, you still might be asking, what is this health gap and why does it exist? And to state it simply, health disparities exist in the United States, and these disparities affect our most vulnerable populations, our racial and ethnic minorities, rural dwellers, and low-income individuals, to name a few. But the crux of the matter lies in the fact that healthcare disparities are linked to an antiquated healthcare system that subscribes to a traditional narrow view of health and healthcare delivery, where historically and even today, our healthcare system is divided into separate siloed delivery systems. One treating physical conditions, another treating behavioral health conditions. And not only do these systems not work together, but they do not integrate well with our social care systems. And this fragmentation has been linked in the research to poor clinical outcomes, increased healthcare utilization, and higher costs, which is bad for individuals and bad for healthcare organizations as a whole. It's this last piece about the lack of integration of social care into healthcare delivery that a growing body of knowledge now tells us is imperative in order to improve the health and wellness of the population. So I would be remiss if I didn't mention how the COVID-19 pandemic has revealed these long-standing inequities in healthcare access and healthcare disparities that are disproportionately affecting our racial and ethnic minorities and other vulnerable populations. Data has demonstrated the stark reality that these populations are contracting and dying from COVID-19 at astronomical rates, disproportionate to the rest of society. And these same communities are experiencing an exacerbation of wide-ranging psychosocial impacts, including high rates of unemployment and underemployment related to loss of insurance coverage, which directly impacts these communities' ability to access needed health and social services. What's important to note is that the pandemic didn't cause these inequities. In fact, they were there long before COVID-19 was ever a thought. And COVID-19 has, however, amplified these pre-existing inequalities, and we can no longer ignore them. So now, more than ever, we must transform and adapt our healthcare system into one that takes responsibility for collaborating with partners in social and behavioral healthcare in order to address the ever-increasing complex and multidimensional needs of the population. So in order to do this, we have to have a radical rethinking about the definition of health and how we deliver healthcare. This includes a widespread promotion of a biopsychosocial definition of health and healthcare delivery, one that focuses on whole person health and wellness, providing care in a truly integrated manner. And I'll argue that in order to do this, social workers are the missing puzzle piece. So what do social workers bring to the table? Well, social workers have worked in healthcare settings for over a century. We're the largest group of behavioral health providers in the United States today. And we, of course, course, have historically led provision of care in the social services sector. In all of these roles, social workers can and do leverage our unique knowledge, skills, and abilities, including employing a person in environment perspective, or essentially the biopsychosocial approach. Social work practice is also rooted in values such as self-determination and empowerment found in the strengths-based approach, which is key to person-centered care. Social workers also have clinical behavioral health expertise that includes screening, assessment, and brief interventions, even if we're not working exclusively in the clinical space. We're committed to social justice and advocacy on behalf of marginalized populations, and we of course demonstrate social care expertise. But lastly, and perhaps most importantly, we have the ability to contribute substantially to the efficiency of interprofessional practice, leveraging our unique position and experience as facilitators and integrators between medical, behavioral, and community-based social service providers and systems of care. So if social workers are natural leaders in implementing whole person or this biopsychosocial healthcare integration that I'm talking about, that's designed to close the health gap, what's the problem? Well, unfortunately, there's still a gap between the research and evidence base and investment into these proven strategies to integrate social care into healthcare delivery, which includes elevating the role of social workers. The role social workers play and the skills we have to offer continue to go unnoticed and untapped in a time when the need is greater than ever. So why does this matter to you? Well, at the end of the day, research, and I would venture to say most of our lived experience tells us that all of us want to be treated with personalized care. Care that addresses not only our biological or physical medical care needs, but also our psychological and mental health needs, and certainly our social care needs. If not you personally, a loved one, a close friend, a neighbor, someone else is affected that you know. And in order to meet all of these needs, the healthcare system really must adapt and leverage the resource best suited for the job, which are social workers. So circling back to our miracle question, what does a transformed healthcare system look like that closes the health gap? And how do social workers impact this transformation? Here's my answer. A truly transformed healthcare system will embrace a widespread conceptualization of health and healthcare delivery through a comprehensive biopsychosocial framework. And it will be a system ultimately where social workers do not merely function in the background, searching for keys, but rather one where our full range of knowledge, skills, and abilities are utilized to the fullest extent, and we are able to make sustainable systemic changes to give every individual the support they need to achieve health and wellness. So I'll leave you with my ask, and it's simple. Help us help you. Social workers are up for the challenge to lead improvements in healthcare delivery toward a shift to whole person care, but we need your help. The next time you head to the doctor's office and they ask you probing questions about your living or financial situation, be honest and ask for a social worker if you need assistance. Or if you notice your elderly mother is struggling to remain at home without support, ask for a social worker. We're here to help. And don't be afraid to engage the healthcare system in working to find solutions to any problem affecting your health and wellness, or of that of someone you know and love. There is no wrong door. So help us help you, and let's work together to build a better healthcare system for us all.